Okay, so we're now going to do the neurological exam of a patient who's had a diving accident. As long as the patient is able to talk to you, then we're going to do the full neurological exam. Otherwise, if the patient cannot talk, cannot respond, is confused, then we prefer that you send them to a medical facility so that they can be examined by a doctor and have medical care, have them being taken care of. So in the first, we're going to divide the exam into 4 different portions: the cranial nerve exam, the sensitive exam, motor exam, and then finally the coordination examination. So first of all, we're going to see if the patient has any visual problems. So we're going to start by looking at the different visual fields. So you're going to close your eye. We're going to close the eye at the same side of the patient, and we're going to ask him to look at the center of our face and tell us if you see the fingers moving.
No. 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 No.
We're going to do the same thing with the other eye.
No. 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 No.
Okay. And now we can just check if all the eyes movements are clear. So we're going to go up and down, and then see if the accommodation is good too. And then we're going to see if the patient hears the same thing on both sides.
Yes.
So just make sure it's symmetrical. And then we're going to see if the light touch is equal.
Yes.
Same sides. And then we're going to go for the motor response of the face. So you're going to close your eyes very hard. And we're just going to make sure that all the frowning is equal. And then we're going to ask him to lift the eyebrows and just make sure that the crease on the forehead are symmetrical. And then we're going to ask you to smile, show your teeth, make sure that the face is symmetrical. Then you're going to shut your mouth and blow your cheeks and make sure that no air is coming out when we press the cheeks. Now you're going to push your tongue in your cheek, and we're going to push it just to make sure that there's enough strength. And we're going to ask you to open your mouth, take your tongue out, move it from one side to the other. And while the tongue is out, we can just sort of look in the back of the throat and say ha, ah, so that we can see that the palate is moving upward in a symmetrical fashion. And lastly, we're going to look at the deltoid. So you're going to put your shoulders up, make sure it's strong on both sides. Turn your head to the left, push in my head. Same thing here. Okay, so the cranial nerve examination is now complete. We're going to go to the sensitive part for the rest of the body. So usually we have to examine the patient in shorts and t-shirts so that the skin is exposed. And we're going to ask the patient if he feels the light touch and if it's the same thing on both sides.
It's the same.
We're going to do the same thing on the legs.
It's the same.
Okay, so on both sides, and make sure it's the same thing.
The same.
So that's basically, if there's something different, then we're going to add more detailed examination, but for the first part, that's enough to say if it's symmetrical. Then we're going to do the motor strength on both sides. So we're going to lift the arms, make sure it's symmetrical. Now we're going to bend the elbows, pull and push. Same thing here. And now we're going to flex the wrists, and same thing through the bottom. All right. And the last thing is we're going to ask the person to take our fingers, and we're just going to try to take them out of the hands. So that's for the upper arms. We're going to do the same thing on the lower legs. So you're going to lift your leg, other leg. Now you're going to press down. One more time. Okay, now you're going to lift your leg and bend your knee. Same thing here, and bend your knee. And then you're going to put your toes up and then down. So that's mainly the neurological. What we're looking for is if the strength is symmetrical, if it's normal, diminished, or totally absent. And the last thing we're going to do is the coordination exam. So we're going to start by asking the patient to take his finger, touch his nose, and then come and touch our finger. We're going to move that around and make sure that the elbow is totally extended. And then we're going to keep doing it with the eyes closed so that we make sure that the patient can touch his nose without seeing. We're going to do the same thing with the other arm. And now with the eyes closed. Okay, good. And now we're going to do some fast movements. So you're going to touch your fingers. Good. And then you're going to do it with the other hand. One other thing that we can do with fast movement is just go and rotate the hand. Good. We're going to do the same thing with the legs. So we're going to ask you to take your heel, put it down your shin, and touch your toe, and then touch my finger. Do it a second time. Okay, going to do it with the other leg. Great. And the last thing, we're going to ask the patient to stand up and do the Romberg test. So we're going to have the 2 feet close together, and then eyes closed, and we're just going to make sure that the patient doesn't fall either way, and we hold that position for 15 seconds. Another way we can do that is by having the patient put the feet one in front of the other and cross the arms on the shoulders, and we do the exact same thing. See? That would be something positive, but it's a little bit more difficult. The last thing we're going to do is we're going to ask the patient to walk on the straight line while the heel is touching the toes. So we're going to ask him to do that. Good. And we can also ask him to do it with the eyes closed also, which adds a little bit of difficulty onto it. Very good. Okay, so that's the neurological exam that we're asking you to perform, and that's what's going to help us follow how the patient is doing and if the patient is improving throughout the treatments.